So to continue, our guest speaker for today is actually an assistant professor of the University of the Philippines College of Public Health, Department of Environment and Occupational Health from June 1989 to 1993, and a senior health advisor and country health manager of the Philippines, Philippine Shell Petroleum Corporation before in up to 2004. He is actually the Occupational Health Business Account Advisor of Shell International up to 2010 and adjunct professor of the Department of Environment and Occupational Health, University of the Philippines College of Public Health. He is presently the Environmental and Occupational Health Executive of the Philippine Holdings Corporation since January 2011. He has been of much help to us during the start of the pandemic because of their contributions to our approach to deal with the COVID crisis way back in March and April of this year. So without further ado, it is my honor to introduce to you our speaker for this morning, Dr. Joselito Gapas.
Can I share my screen, please? There you go. Right. Good morning, everybody. Good morning, ladies and gentlemen. Dr. Rose Liquete, NKTI head, Ernike, who is organizing this event, members of the management committee, colleagues in healthcare, and ladies and gentlemen. Thank you very much for giving me the opportunity to share my thoughts about COVID-19 and how to protect our healthcare personnel in these times of COVID outbreak. So when I was requested by Ernie to speak about health and safety of health practitioners, especially frontline workers, it was a big challenge to me because I am not familiar or comfortable with working with COVID-19 actually through the patient going into the workplace. My comfort zone was working in companies where we try to prevent COVID-19 from getting in. But this is a unique situation and a good opportunity for me to look at what are the occupational health and safety aspects of healthcare providers during the time of COVID. So the title of my presentation is Health Worker Safety, a Priority for Patient Care. The need for occupational health services and programs, the need for occupational health services and programs to protect health workers remain as important today as before the COVID-19 outbreak. Addressing this need will require health institutions such as NKTI to remain focused on the health and safety of their most valuable asset, their human resources, as they continue to deliver safe and effective health service to their patients. Institutions will need to be more agile, innovative, and focused because of a continuously evolving situation brought about by COVID-19 outbreak. So our session for today will cover several topics: workplace health services and programs, and the role of senior leaders in its development and implementation. Isa po ito sa napaka-importanting kailangan if we are going to succeed in ensuring the health and safety of our workers and of our patients. Because it is our senior leaders who will give us support, who will give us the leadership, and who will give us direction in ensuring the health and safety of health workers and patients. Second, we will be talking about understanding the COVID-19 outbreak and learning to dance with the virus. We cannot dance with the virus if we do not see its movement. To have a dancing partner, you should be able to see your partner. And the only way to see the outbreak right now in its totality across the Philippines is to be able to know how to use existing statistics. So we'll have a few slides on on this. Third, we're going to talk about protecting health workers at work, in the hospital, for example, at home, and as they travel to and from work. We're also going to link protecting the health and ensuring the health of patients because the health and safety of patients is intertwined with the health and safety of workers. These two cannot be divorced because you find yourself in the same geography, you find yourself in the same health processes that you manage in the hospital. So the health workers and their patients should be able to dance with the virus as well. We will talk about how important information and timely information at that, and boosting workers' awareness to ensure success in whatever we're trying to achieve. Because it is only through information and awareness that workers will understand why they need to comply, why they need to stick to so many protocols in the hospital. And lastly, we'll talk about all of the nice things that the hospital and your team is doing in protecting the health workers and the patients need to be merged together into an occupational health strategy and program so that it could be managed successfully and sustainably. This outbreak will not disappear in this year. It will take maybe 2 more years, hopefully less than that, for the outbreak to eventually be put under control. So we're going to go through these things. What we're not going to do is go to the specific details of control. And the reason for that is when I was viewing all the entries, your videos for health and safety, I have realized that you have already deep dived into the details of risk assessment, the control measures to prevent exposure to COVID-19. Okay. So from the perspective of occupational health, what do we want to achieve? We want to achieve 4 things. We want to prevent occupational diseases and work accidents. We want to prevent healthcare workers from contacting COVID-19. We would like to control workplace health hazards and risks. Not only COVID-19, but the other health hazards in a hospital setting. Above that, we want to achieve a healthy and productive work environment and the type of work that is conducive to workers' health. I note that in one of your presentation earlier, you have emphasized the time out that the doctors pulled last month, because at that point, sometime in August, first and second week August, really work in the front line was no longer conducive to workers' health, both physically and mentally. And that at that time need to be corrected. So occupational health programs and services will remain vital to healthcare organizations before, during, and after the COVID outbreak. In many companies, before the COVID-19 outbreak, we are working with this framework. Essentially, what health organization or work organization put in place are divided into 2 areas: occupational health programs and health services extended to workers. When we talk about occupational health programs, we talk about many things. We talk about health risk assessment and management, trying to identify, evaluate, assess, and control health risk in the workplace. Not only COVID, there are many health hazards at work. We talk about ergonomics. We talk about the physical hazards, like radiation. We should have a mental health program to support our workers. Healthcare workers at that need extensive mental health assistance and support. I remember the recurring theme when I was in medical school, where all classes make a presentation in a competitive manner. And ang tawag namin doon ay tao rin pala. Because at the end of the day, healthcare workers like us are vulnerable to both physical and mental health hazards. We talk about substance abuse and management, chemical hazards in hospital settings. We talk about health and wellness, managing infectious disease, or work environment monitoring. All of this we do before COVID outbreak as part of occupational health programs in the workplace. Many organizations, not only health, also make sure that health services are available in their organization. Things like fitness to work or fitness for duty, medical emergency response, in case a worker gets sick or has an injury. What should they do? Access to outpatient services and referrals, medical data management. All of these protocols and programs and strategies in the workplace needed to be supported by communication, instruction, and training, implementation, monitoring, review, and audit, internal and external stakeholder engagement, health competency development and training. So all these strategies and programs are merged into a health management system, either OSHA 18001 or right now we're moving towards ISO 45001. We have to manage health at that point before COVID and health programs just like any other business as part of the management system. The COVID-19 outbreak added complexity to the development and implementation of occupational health programs and practices. Mind you, the health hazards and the health concerns that we were focused on before COVID are still there. They didn't go away. It just, the COVID-19 just added another dimension, added a big hazard, and made implementation of our programs more challenging. I mentioned earlier that dancing with the virus requires an understanding of your dancing partner. So I am sure, being in the healthcare profession, many of you have come across this article by Thomas Pueyo entitled The Hammer and the Dance. In this article, Thomas has clearly illustrated in a very simple manner the life cycle of an outbreak. And in that life cycle, Thomas divided the outbreak into two, the hammer phase and the dance phase. The hammer phase is the phase of the outbreak where the conditions are severe. You could see an inverted bell-shaped curve that rises up to a certain point where a semblance of control is achieved and it goes down. Okay. The idea of the hammer is that we should hammer the outbreak to make sure that we bring down the curve so that the healthcare system capacity of a country like the Philippines is not overwhelmed. And government has done that through the implementation of ECQ and modified ECQ. But the hammer phase is not as simple and as beautiful as this bell-shaped curve. Sometimes it is skewed to the left, sometimes it is skewed to the right. It is not as smooth. Sometimes it has ups and downs, peaks and valleys, simply because the outbreak and the implementation of control measures would vary from time to time. But hopefully at the end of the day, the outbreak pattern could eventually be tamed and it will gradually go down and achieve a background level before eventually it disappears. And this is what we call the dance phase. And the dance phase is we begin now to actually dance with the virus. The dance phase is not as smooth as shown in the graph. Actually, the dance phase consists of peaks and valleys, moving up, moving down, appearing in one side, disappearing, appearing in another province, and so on and so forth until control is achieved either through immunization or achievement of herd immunity. And this is what we're seeing right now in other parts of the Philippines. Okay. In the national capital region, I think we are still in the hammer phase. We have a protracted hammer phase. In various provinces in the Philippines, they have gone through the hammer phase and now is dancing with the virus. A very good example is Cebu. Cebu, a few months ago, was the second epicenter of COVID-19 in the Philippines. The generals were brought in to control the outbreak. And now Cebu has reached the dance phase, and hopefully they will sustain the lower level of outbreak in the province of Cebu. So that is how we will dance with the virus. 2 steps forward, 1 step back. It comes up, we chase after it, it disappears and goes up again in another location. Happening all over the Philippines. So where are we in the national capital region? I think we are here. Okay. And for us to see how the virus is moving and dancing, we should be able to appreciate the statistics provided by the department now. It is not a perfect system. I don't believe that there's a perfect system anywhere in the world to monitor accurately the way an outbreak is moving in a particular country. But we do our best. And this is the best data we have in the Philippines. This is the statistics as of September 16. And what do we see? Okay. Although the total cases have been rising, 272,934, there are also recoveries. And the important thing is to look for the active cases, to focus on the active cases. This is the total burden of disease that we're looking at. That at least we can measure and test. Right. So what do we see? What is the outbreak telling us? Where is the dance now? At the moment, existing Department of Health data shows that around August, we have flattened the curve. And beginning late August, moving into September, there is a gradual trajectory of going down. We hope to sustain this. We pray that we could sustain this moving forward. We hope that in spite of relaxation of quarantine and opening up of business, we could add on more control measures to make sure that the trajectory of the outbreak goes down, or at least stay flat, to give the healthcare sector a chance to prepare and increase their capacity to address the outbreak. This is how Metro National Capital Region looks like. Similar to the national statistics, primarily because the NCR is the main contributor of over 50% of cases to the total population statistics. Okay. But if we look at the behavior of the outbreak based on the daily cases reported, late August and going into September, the National Capital Region has shown a much steeper, lower trajectory than the country. Maybe we are performing better as a region compared to the rest at this point. We hope that the positive trajectory can be maintained. And if we are indeed successful, we would gradually go down the slope of the outbreak. I'd also like to share with you some statistics from the UP OCPA. My preference is for Filipino statisticians and epidemiologists to compute the data because they are nearer to the data compared to other international agencies computing as well. What I'd like to share with you is the reproduction number. And the reproduction number, or RT, is the average number of people who become infected by a single infectious person. To ensure that an epidemic is under control, the reproductive number should be less than 1. What is an RT of 1? An RT of 1 means that one infected person would only infect one other person. And that infected other person would only infect one other infected person. What it means is that with an RT of 1, the outbreak is stable. Okay? An RT of less than 1, this is good. The epidemic is coming under control. An RT of more than 1 means that the outbreak is expanding. All right. So what do we see here? What is shown here on the left figure is the reproductive number in the Philippines, the total Philippine reproductive number from the time of the outbreak up to September 10. The RT as computed by UPOCTA as of September 10 is 0.99. This is good. This is below 1. If we look at the reproductive number in Metro Manila, which is shown by the right figure, what you can see is that the reproductive number in NCR is performing better. You could see at the rightmost part of the figure the lowering trajectory of RT. In fact, as of September 7 in Metro Manila, the reproductive number is 0.66. This is very good, depending on the accuracy of the data and the accuracy of the computation of RT. But in any which case, it gives us hope. It gives us, it sends us a message that in spite of not having a vaccine, we have the capacity to control the spread of the outbreak. If we do our act together and we do it together with all stakeholders, right? So what do we expect up to the end of the year? Again, this is the projected RT up to December 31. The mean or projected RT is the blue figure, the blue line. The upper red and the lower green is the 95% confidence interval. So if we look at the blue line, what it is saying is if existing control measures are implemented properly, then hopefully we are going to have a plateauing of the outbreak up to the end of the year. What I have shown here in the blue box is the actual computed mean reproductive number for September 10, 2020. I have shown this early in my earlier slide. It is 0.99. If we compare it to the projected mean, the projection is 1.2. So the projection is a little bit overestimating the true data as of September 10. But regardless, this is not far off. And what the projection is telling us is around December 31, 2020, by the end of the year, the projected reproductive number is 1.16. Of course, there is a wide margin of error. Anything can happen. Government is now trying to reduce the physical distancing requirement in public transportation. We are now opening up the business. That means more workers are coming into the workplace, more potential for close contact encounters. But at the same time, we're beefing up control measures. We're beefing up our healthcare system. So hopefully, from now until the end of the year, our outbreak situation shall remain stable. So this is the first part of the dance. You have to know your dancing partner, and your dancing partner is the coronavirus. And the data that it's telling us is the virus will be there up to the end of the year. Most likely, the virus will be there. The outbreak will be the same, like where we are right now. This is how our dancing partner looks like. But it takes two to tango. So if one of the dancing partner is the virus, the other partner are people. And in this discussion, we will be talking about two cohorts, the healthcare worker and the patient. The healthcare worker and the patient will need to dance with the virus. And one of the best ways, in my experience, to understand the dance is to have a visual representation of all the protocols and control measures that we are using and putting in place. That healthcare workers, for example, should have a clear how to imagine all these protocols from masks to bunny suits, hazmat, physical distancing, regular checking and monitoring, and so on and so forth. All of this nice thing that you do can be visualized as everything that will create a bubble. So this is the concept of a safety bubble. Individual health workers, as you go around in your day-to-day tasks, at work and outside work, you are living in your own bubble that protects you from the COVID-19 virus. And this bubble is all the control measures that you have put in place. The patient as well, whether in the hospital or ambulatory, should imagine themselves to be living inside a bubble. And the bubble are all control measures and protocols, the awareness and the briefing and the understanding that we give to the patient to make sure that the bubble that surrounds the patient remains strong and intact. These two bubbles need to function well because these two bubbles meet and interact in a healthcare setting. You cannot only focus on one, you have to focus on both. So let us talk about the bubble of the healthcare worker. Us. Okay. We live with many bubbles. We carry our bubble individually, but we also create a bubble around the workplace. We create a bubble around NKTI, which helps support the bubble of individual NKTI healthcare workers. Okay. So this is the workplace bubble. But this workplace bubble alone or addressing COVID-19 in the workplace is not sufficient because many or all of us travel between work and home. And we need to carry our bubble while traveling. That's because traveling exposes us to certain risks. Whenever we go out of the community, you want to go to the salon, you want to go to the mall, you want to go to market, you want to go to the grocery, and everything that we needed to do as part of our daily living, when we go out to the community, we carry our own individual bubble as well. We wear masks, we put our face shields on, we do physical distancing, we do hand washing. We make sure that we go out only for essential activities and so on and so forth. This is the bubble that we surround ourselves when we go out the community. Lastly, we have a bubble at home. And allow me to spend a few minutes talking about the bubble at home. We have to protect the home. We have to protect our loved ones. We have to protect our household members. But there's something funny that happens at home. When we are at home, our individual bubbles disappear. We stop and weaken our individual bubbles, and we rely on the comprehensive bubble that surrounds the home. And this is one of the most vulnerable bubbles that we have. When we are at home, we don't wear masks. We don't wear face shields. We do not physically distance ourselves from our loved ones. We laugh, we talk, we shout, we're happy. We argue. Droplet spray and aerosols are released in the home because our individual bubbles in the home coalesce to become a bigger bubble. And this becomes vulnerable to us. Why? Because you have to make sure that other members of the household remain or maintain their bubbles when they go out. What if you have a household member who is also a frontliner? Maybe not a healthcare worker, but somebody else, a policeman, okay, somebody who goes to the office every day and exposes them. What if you have somebody at home who is a security guard, who for 8 hours a day or 12 hours a day would have daily contact with the general public? If they do not maintain their individual bubbles while at home, when they go back home and your bubble coalesce with their bubble, that is where the greatest opportunity for transmission occurs. In fact, at present, at least across the workplaces that I work with, more than 50% of exposure, in fact, more than 70% of close contact exposure leading to positive COVID-19 diagnosis happens at home. Either an asymptomatic household member or taking care of a COVID-19 member. Other than the home, more and more cases right now are happening in the community. We see friends. We take time off. We meet 3 or 4 friends in the restaurant. Okay, that is also a potential source of exposure, because it is in this very joyful event that we let our bubble down and they coalesce with the group bubble. All right. So these are the 4 bubbles that you should be able to realize you have as you go through work and as you go home and out in the community as a worker and a health worker as that. Okay. Our patients also live in a bubble, and what applies to them, to you, to us, applies to them as well. There are non-COVID patients in your hospital. I am sure that you have protocols and programs to keep them inside the bubble while in the hospital setting. There are patients, there are COVID patients in the hospital as well. And what you have is a reverse bubble to make sure that the virus remains inside the bubble as far as the patient, infected patient is concerned, and does not go out. You have outpatients that you follow up on a regular basis, and they travel between hospital and home. And while at home, their bubbles also coalesce with the bubbles of their household members and loved ones. When they go out in the community, they carry their bubbles as well. So what I am trying to say is, whilst in the workplace, in a healthcare setting, we are focused on protecting the non-COVID patients and enclosing them in a bubble, and the COVID patients enclosed in a bubble as well to prevent the virus from going out. We should also give information and awareness of this to our patients, especially those that are on outpatient basis, to take care of themselves while traveling between hospital and home, while moving about in the community, and while at home with their loved ones and family members. Because there is regular interface and contact between the worker's bubble, the healthcare provider bubble, and the patient. So think about it, that the information we give to our patients does not or should not only involve their disease and the precautions that they would take while in the hospital, but also include precautions that they should take while traveling, while in the community, and while at home. Because majority of your patients get well, and they will go home, and they will follow up with you. And what we do not want is patients following up with a healthcare provider, bringing along COVID-19 with them. So, colleagues, what I have tried to share is that if we would like to dance with the virus, we should be able to see the two dancing partners. We should be able to see how the virus is moving around in our society, look at the statistics, and you should see or imagine how a health worker and the patient is dancing with the virus as well. And you could imagine your bubble. You're carrying your personal bubble with you. There are opportunities that your personal bubble now are coalescing with the personal bubble of other coworkers. I could see in the screen in NKTI a big room where there are around 4 or 5 people in one room. You maintain your individual bubbles by wearing your mask, but you also are now part of a bigger bubble which is supposed to control or protect you while inside that room. So that is how we should imagine so that we could be able to dance effectively with the virus. All right. So much of imagination. Okay. Let's look at the occupational health and safety framework at work. Again, I refer to bubbles because these are, we need to, whilst individual workers have their own bubble, the hospitals or the department or the division should have their own generic bubble as well. And in any organization, I see two big bubbles. The first one is a bubble, which is the borders are maintained by control measures to prevent seeding the workplace with COVID-19. And the second bubble is all precautions and protocols to prevent spread of COVID-19 in the workplace. One thing the hospital or healthcare setting is challenging is because it's quite difficult to prevent seeding the workplace. Because primarily, people suspected of or sick with COVID-19 goes to the hospital for diagnosis or treatment. Unlike in other workplaces where preventing seeding is, shall we say, easier versus a hospital setting. And likewise, preventing spread within a hospital setting also becomes more challenging because of the close interface with suspected and COVID diagnosed patients. But in any which case, all the control measures in NKTI to prevent seeding the workplace or to prevent spread in the workplace, the success of this endeavor is dependent on the company or the hospital senior management providing leadership and support. It remains the key to a successful COVID-19 health and safety program. Without senior management leadership and support, we will not be successful in reaching our goal of protecting our workers and our patients. From a patient perspective, we also have two same bubbles. When you go home, you look at your loved ones, you look at your home, your household members. Think about these two bubbles. Bubble number one, how do I prevent seeding the home with COVID-19 virus? And one of the strategies that we always keep in mind is after duty and we're going home, there are protocols that we need to do so that we don't bring the virus into our home. That is seeding. We're trying to prevent seeding the home with COVID-19. We prevent or we discourage visitors or friends to go to our homes. That is preventing seeding. Okay. We don't go to market or to the grocery as much now. We do home delivery. That is preventing seeding the home with COVID-19 virus. On the other hand, equally important is to prevent spread of COVID-19 at home. We tell our loved ones to regularly wash their hands, okay, to monitor symptoms, and to act fast if there are potential symptoms related to COVID-19. So these two balls, the bigger control measures, apply both in a hospital setting or in an organizational setting and it also apply at home. We have to look at it in this way so that we could have a working framework of all the protocols and control measures that we need to keep in mind. Vital at home is ensuring that patient information and awareness is vital. It is needed because these bubbles is dependent on an improved knowledge of the patient or the bantay of the patient, resulting in a positive attitude towards prevention and protection, and eventually taking action to protect themselves and their household members. So nakasalalay ang bubbles na to sa proper education and awareness and understanding. Again, because when we go home, our individual bubbles disappear. We relax. And then we need to be protected now by a bigger bubble at home to prevent seeding and to prevent spread. So in the workplace setting, moving away from the home, we've said, let us prevent seeding the workplace with COVID-19. It is very challenging, as I mentioned earlier, in a hospital setting because patients come to you. And in fairness, the healthcare sector has significantly improved in its protocols to protect healthcare workers since February up to the present. Okay. So we have family protection program. It prevents seeding the virus with the workplace. You have families. So bear in mind, educate your family members on how to maintain the bubble at home. Because what we do not want is healthcare workers being infected, not in the hospital, but at home. And eventually bringing the virus to work. Preventing seeding the workplace also involves having a safe journey program, protecting the workers as they travel to and from work. We'll talk about that a little bit later. And of course, preventing seeding is can also be ensured by having health screening protocols of workers and patients. I am sure that NKTI have a screening strategy for its health workers, and I'm sure that the patients are being screened as well. For example, before an elective operation, most likely you would require what? A PCR test and perhaps a chest x-ray. That is preventing seeding the workplace with COVID-19. Okay. So a little on family protection. All right. Our household members need to know, number one, how to protect a healthy household member or a healthy household during an ongoing COVID-19 outbreak, whether we are on ECQ, modified ECQ, or GCQ. And all of us know all these things. Social distancing or physical distancing principle, hand hygiene, cough etiquette, cleaning and decontamination, sanitation, and waste disposal. We all know these things. But do we really implement them when we are at home? Where the protocols are no longer as rigid, and it is really up to us to make this happen. Okay. Household members will need to know, use face masks outside the home. And now please use face shield as well. And we keep saying, prioritize and organize your trips. And if possible, only essential trips need to be done. I remember one of the in one of the companies that I was helping, one of their main challenges is this. When, for example, their area was downgraded from GCQ to MGCQ, one of their workers, the first thing she did was went to the mall, did a little shopping, went to the salon, had a haircut, shampoo, fixed her hair, facial, pedicure, manicure. Okay. Because we forget that we forget our bubble simply because the restrictions have been relaxed. And I keep telling the people that ask, if the restrictions are relaxed as we go down And the virus is still there. The outbreak is still there. The relaxation of the quarantine status is primarily driven by opening up business. In fact, I should be more worried from a health perspective when we relax our controls. We have to inform or make our household members understand that. We should make them understand the awareness, what the signs and symptoms are, so that we can act on it immediately and how to monitor properly. We also have to look at mental health issues at home. You know all the jokes about home quarantine, about working from home. Before we pray that we will have more time for the family. Before we pray that we would have more vacation days at home, and so on and so forth, to do personal things and personal errands. We would like to have time to pursue hobbies. And suddenly it's been given to us for the past 6 months. And we find out that it has also caused additional stress in the work, at home. So all of these things will need to come into play into protecting the family and the household. Household members would also need to know how to take care of a suspected or confirmed COVID-19 case on home quarantine. Although now government is pronouncing that home quarantine is no longer allowed, and we have local government quarantine facilities and hotel quarantine, I am sure many in the population would still opt for home quarantine. So we should know how to manage somebody on home quarantine. And these are the things that need to be considered if you are contemplating on home quarantine. It is this basic knowledge, both number 1 and number 2, that our family and household members should know so that we can have a protective bubble across the home to protect ourselves, our family members, and the rest of the members of our household. It is not only the workplace, it is the household, the home as well, that need to be protected. A little talk on SafeLink, where we have to ensure that traveling from work to home is safe, and we manage the risk of exposure, exposing our workers to the outbreak. Just a short mention that there are safe modes of transportation, assuming that we ensure proper and regular cleaning and decontamination as needed. Private cars or vehicles are good. Motorcycle is good. Bicycle is good. Walking is good. Shuttle is good. Because you can control your bubble in this modes of transportation. Your bubble is stronger. The less safe mode of transport would be basically use of public transportation. And if you imagine the bubble, whenever you use public transportation, each of you would be moving around inside your bubble. And your bubble now would coalesce or come into close contact with the bubble of the other passenger. And if that other passenger's bubble is weak, then you could see the potential risk for exposure. However, if you keep your bubble strong, which you have control, by the way, by wearing face masks and face shields, practicing hand hygiene when you reach your destination, following good cough etiquette, and social distancing if possible, you maintain your individual bubble strong, and most likely and hopefully your risk for having close contact or exposure to COVID-19 would be greatly diminished. So what I'm saying is you are in control of your personal bubble, and it is up to you to keep it up. Okay. Not going into the details, but gradually integrating COVID-19 into the basic occupational health and hygiene principles is that when we control the spread of COVID-19, for example, in the workplace, we need to consider a hierarchy of control. Of course, the most obvious in the hierarchy of control is elimination. But we couldn't eliminate the COVID-19. You are in a hospital setting. The virus comes to you via the patient. Okay. Could you substitute I don't think so. COVID virus, you couldn't substitute with another virus. So elimination and substitution might be controls that are not applicable in this case. However, engineering controls, which if is more effective, if practical, can be put in place. You can either isolate the health workers from the hazard, which you are doing by engineering controls, proper ventilation, partition, and so on and so forth. Ultraviolet lighting. Okay. We do a lot of administrative controls and protocols. Okay. And lastly, of course, PPE. I would not go into PPE because I could see that using the right PPE is part of your daily work since the start of this outbreak. Okay. Okay. So these are the things that again we need to put in place to manage the spread of COVID-19 in the workplace. We have a lot of protocols. We do a lot of distancing, PPE, hand hygiene. We do cleaning and sanitation more often and more intense now than ever. We monitor our workers and survey them and make sure that any signs and symptoms indicating COVID are addressed properly. We do contact tracing. We isolate suspected cases. And in companies outside of the healthcare sector, what we do is we refer and work with the local government unit or the health facility for treatment and quarantine. This is part of the general workplace strategy to prevent spread in the workplace. The workplace. What I'm showing here is that it, again, to reiterate, it is company or hospital management commitment and support that is key, together with a competent health team to make sure that all the protocols are in place and managed properly. This is the key to a successful control and management of the COVID risk. Okay. I'm sure you did worker exposure assessment. I am sure that you have divided the hospital into various zones, for example, based on the risk assessment. You do social distancing, you do hand hygiene, you have your cough etiquette, you have your workplace sanitation and decontamination. You wear PPEs, you have workplace screening, monitoring and surveillance, contact tracing and referral. You do a lot of information and awareness. And you have contractors that support you in your day-to-day operation. Please do not forget their needs because they are part of the overall bubble of NKTI. In general, contractors are less able to provide the right strategy and protection compared to us. And we are only as strong as our weakest link. I keep saying that to all companies. So do not leave anybody behind in terms of protocols and control measures. The virus does not recognize work status. Right? I'd like to end the remaining part of my session with you on two topics. And the first one is mental health and emotional well-being at work and at home during COVID-19 outbreak. I am not an expert in mental health nor well-being. What my objective here is to call your attention not to overlook this vital component of our workplace program to protect our health workers. Okay. There are many causative factors why we have mental health issues and which affects our emotional well-being. It's uncertainty of the future. Right now, it's quite difficult to see the light at the end of the tunnel. So uncertain, we don't know. We are strong when we started, but sometimes it becomes more challenging when you don't see the finish line. And because of that, it can have mental health effects on us. Job insecurity. Well, this might not be a big issue for healthcare workers because healthcare workers now are in demand, I think, or reduced income based on your baseline income. I think this is not a main issue for healthcare workers. But believe me, for the rest of our workers, non-health workers, this is a big, big, big issue right now. This is job insecurity and reduced income versus needs. Okay. For those who still have jobs, they have work sharing. One job split into two, or three, or four, unable to meet the day-to-day needs of family. So that is a very, very strong source of mental health issue. Second, social isolation and limited access to regular relief strategies. Okay. Whilst we are becoming more linked via social media, via this sessions like this, people are social animals. We need to have day-to-day close contact with relatives, family members, with friends, with colleagues. It is us. It's part of our DNA because we are social animals. And that has been taken away from us. And it would have an impact on us. Limited access to regular relief strategies. Many of us, if not all of us, when before the outbreak see ourselves as matatag and malakas ang loob at kayang harapin kahit anumang struggle. But sometimes what we overlook is that we were able to say that before because we have regular relief strategies. When you feel stressed or down, you go to the movie. You visit friends or family. You go shopping. You go to the mall. You know, retail, tawag nila retail therapy. Okay? All of these things are no longer there. Our unconscious relief strategies before COVID disappeared. And if we try to bring them back now, since malls are opened anyway, there is always this fear of being exposed to the virus. So in general, our relief strategies have disappeared. And we need to find new ones, akin or appropriate to the existing situation. Third, there's lack of control in our day-to-day life. Okay. Right now, my life is controlled by my webinars and my telecom because I'm staying at home. From 8 in the morning to 8 in the evening, that is my life. I have no control because this is how we do things. It is even very difficult to do forward planning. One of my stress relief is actually travel. I love to travel, but I cannot even plan for it right now because we don't know when exactly we are able to do so. There is prolonged and blurring of working hours, especially if you're working from home. Okay, I know that our director earlier mentioned that many of you guys couldn't work from home because you need to be face-to-face with your patient. But some of you, I think the more senior, now are working from home or do teleconsulting. So working from home has blurred our working hours. There are stressors at home and at work that is blurring now and integrating and becoming vague. It's something new. And lastly, there's no end in sight for the COVID outbreak right now. We have hope. We have hope for the vaccine. But until a safe and efficacious vaccine is developed, and until the needle is in your arm, that might be the start of the stress going away. But until the needle is in your arm for the vaccine, it is difficult to say that there is an end in sight at this time. Right. So what are the interventions in our workplaces that I work with? We make sure that management, senior management, is always transparent with the workforce. What is happening to the hospital? What are the challenges? What is happening to the company? What is the financial standing? What is our future? What are we doing to ensure our future? We have to be transparent and maintain this regular dialogue with our workers. Otherwise, if there's a vacuum of data, our workers will invent information to fill up that vacuum, and that will not be healthy. So first intervention, clear management transparency and regular dialogue. We need to consider work adjustment and rebalancing. When we say work adjustment and rebalancing, for non-healthcare workers, for example, we have workers that are more than 60 years old and above with comorbidity. Then we would say you work from home. And we would rebalance the work to make sure that the work that he couldn't do at home is taken away from him, and additional work is added in replacement, which can be done at home. While the work taken away from him is assigned to a younger and healthier workforce that is able to go to work. This is what we call work adjustment and rebalancing. We do a lot of kumustahan sessions, and in some of these sessions, we drag our senior leaders with us. It's not to talk about business. It's not to talk about the future of the company. It is basically asking the question, kumusta kayo? Kumusta ka na? And senior leaders would also share how are they managing? Because this breaks down barriers, and we begin to see leaders just like us going through the same challenges of COVID-19. Okay. We do a lot of health wellness initiatives online. We do mental health and emotional well-being sessions online, and we provide access to counseling services and hotlines as well. Okay, so these are some of the things that that we can do to our workforce to support their mental health. And the good thing about healthcare institutions like NKTI is that you have the resources to make this happen. These are just examples of what we do at work. We have a reach out program where employee can reach out to third-party counselors online, and they could even organize face-to-face sessions if needed. Right now, it's more challenging because of COVID, but the hotlines and the chats are receiving unexpectedly high demand. We are running a resilience series, and these are a series of modules to educate our workforce that, yes, these are difficult times, but just look at the tree. It is sitting precariously on a cliff, but if you look at the leaves and the branches, they are healthy and thriving because the tree has learned to be resilient to adversity. And we can build on this idea online so that our workers would get the message that we can be resilient. Other topics like taking care of your relationships. Maybe this is the best time to build your relationships or rebuild them so that you can have more emotional and mental support as we move on with the outbreak. So lastly, my last message is, let us make always our workers informed and aware of COVID-19. Our workers, not only healthcare workers, but our support staff, our contractors, our patients, will need to understand COVID-19 and the strategy to address this. Because understanding will lead to the development of positive behavior, which leads to better compliance both at home and at work. In many cases in our company, we scratch our head because we keep telling them, alam naman ng tao ito, bakit niya ginawa to? It's always that discussion repeated again and again whenever we have an incident. But it's simply because we don't realize that knowledge alone will not result in good practice. Knowledge will need to be reinforced so that there will be positive behaviors first for compliance to happen. People, workers should understand that these control measures, what are they for? It's for themselves, for their coworkers, for their patients, and for their loved ones. Until they understand that and develop a positive behavior, that is the only time when compliance is achieved. And compliance means each of us, up to the end of next year perhaps, will be able to maintain our bubble so that at the end of next year, hopefully, when we see the light at the end of the tunnel, we will go to the sunshine into a better normal for us. So this is an example of a company's regular health advisory. Okay? Keep them informed on statistics, on prevention, on our hotline numbers, both COVID hotline and telemedicine. And we use posters from the Department of Health, from WHO to send messages. There are a lot of informatics out there. So this one is on mental health. We do this every day. It is released every day because we see that this is our lifeline, our COVID line, and link to our workers. So let me end by summarizing and reminding us that to dance with the virus, we have to look at and see the virus, how is it moving, and we need to see ourselves. We have to imagine ourselves in the bubble when we're at work, traveling between work and home, community, and whenever we are at home. Let us not forget that our patients are also living in a bubble, and we have to help them maintain this bubble while in the hospital, traveling between hospital and home, while in the community, and while at home. Okay. Thank you very much. That's all. Are there any questions or comments?
Hi, I'm Luis Limchu. I'm the head of the adult nephrology. Very interesting talk. I like the broader pictures that you paint. I'm particularly interested in the kumustahan session. It's a mental stress has been a big issue for some of our trainees. No? So I think we will implement that. The question that bothers us right now, being a training institution, is very hard to attract trainees who are willing to go to the hospital because, obviously, of the fear. Do you have any methods so we can increase attracting residents and fellows like us?
Yes, very interesting question. To be honest, I don't have the magic answer to that. But I would focus on what we call employee or worker value proposition. When we attract talent to our company, we always keep in mind, okay, what is the value of the proposition I'm offering to this recruit? Okay, and that does not only mean salary. It doesn't only mean benefits. It also includes career prospects, how good the workplace is, how collegial the workforce are with each other, and all these things that go into one package and say, ito yung aming value proposition sa'yo. I know it's challenging right now because the recruit would also have its own perceived value proposition. Ang mabigat sa recruit ngayon is, bakit ko kukunin yung trabahong yan? Eh, ayoko yung risk. Mag-usap ulit tayo after the end of the outbreak. Yun eh. So, yun yung naglalaro sa isip ng maraming recruits right now. I could delay my training by 2 years. Why not? I've been training the whole of my life anyway. So, you have to look at ano yung ina-expect na value proposition ng worker, ng recruit. Maybe in your value proposition, you should be able to paint to the recruit the picture of how well are you controlling COVID-19 in your workplace. How well are you protecting your workers? How well are you protecting the patients so that the workers are protected as well? Kasi yun yung naglalaro sa isipan ng mga trainees ngayon. And I think this conversation today gives you an idea on how to prepare that value proposition that you could offer your potential recruits. Okay, it's like a bag of attractions that you're offering, from salary to benefits to worker safety and health, patient worker safety and health. You throw in the good training opportunity that NKTI will provide. It's all given. But the new thing in the basket right now is healthcare worker safety and health assurance. Paano yun? Yun ang hinahanap ngayon eh. So your main sales pitch should be that. Dahil yun ang naglalaro sa isip ng mga potential trainees.
Thank you. That was very helpful.
Any more questions or comments?
Lito, this is Ernie. No?
Hi, Ernie. Yes,
So,
good morning.
Thank you for a very, very wonderful lecture. You have actually gave us the proper perspective on how to look at this pandemic and how we can actually enhance promoting healthcare and patient safety. Now, I totally agree with you that our strongest link, depends on is actually based on our the weakest link, which more often than not we tend to forget and not consider in our approach. Okay. Now you have mentioned that contractors actually is a very, very important aspect in the control of this infection, and sometimes we actually tend to forget about these contractors, since they are not actual employees of the institution. Now we have actually been starting on this, to actually educate and change behavior of these, let us say, more frontliners, the janitors, housekeeping, security, which at the outset, our concentration for control of infection is actually on the healthcare or health worker frontliners, the ones totally exposed to the virus during in our ER COVID areas. So I think the perspective that you gave is really very apt and proper, wherein we are able to see the total picture of how the environment outside the institution is very important in the control of the infection within the institution for our healthcare workers and our patients. Again, thank you for a very, very wonderful lecture, putting everything in its proper perspective.
Thank you very much, Ernie, for your kind words. It is always a pleasure sharing my thoughts and ideas with NKTI.
Any more questions from the group or from the chat box?
Thank you, Dr. Gapas, for that very informative lecture. If only we can control and everyone's bubble. Hospital, ourselves mismo, no? You protect yourself, so you protect others also. Uh, but the thing is, maybe we can control the workplace, but not the community. Because our health workers, they go home, right? They take the transports. We provided them transports, pero alam mo na, the usual Filipino thing, mga pasaway. Just right now, I got a text that in one of the transport that we provided, people were talking with their mask on their chin and all. So how can we protect these people? Behavioral change, no? Uh, it's hard because it's the healthcare worker you want to protect, but then when they go out of the hospital, in their transport and even in their families, hindi rin naman sila, they don't take care of their bubbles. And you know, if they get sick, we also take care of their asawa, anak, etc. Huh? Para bang they rely now on the hospital to also to support the swabs of their family members, etc. And then they would say, oh, the hospital is anti-employee. I don't know what they really want, no? We have tried everything. Kulang tayo ng advocacy, lecture, etc., etc. Oh my God, sabi ko, hindi na siguro yun tama na kulang pa tayo ng paalala sa kanila. So this lecture is very important, and I'm saying this because I hope a lot of our health workers are here now, listening, and of course, as I said kanina nga, pag-usapan niyo ito sa inyong family, sa bahay niyo, because it concerns also the family, right? Apektado din lahat ito. And yan, yung pag-uusapan nito, that will spread the word. So thank you. This is just a comment. Thank you. I know we cannot solve all the problems of our health workers and their families. So thank you, Dr. Gapas.
Thank you, Dr. Liquete. Thank you very much for that comment.
No more questions?
Hello. Good afternoon. Good morning, sir.
Good morning.
Gapas. Hi, Dr. Celerio po, sir. So I would like to thank you for that wonderful presentation that you gave us your thoughts on how to take care of our workers and being patients themselves. Most of at sometimes it will really give us a lot of help in addressing our concerns for them. Sir, I would like to probably ask your opinion because our institution has demand for services. Okay, so our services primarily concerns hemodialysis, organ transplantation. However, these services necessitates manpower requirements. Okay, so these manpower requirements, sometimes we have to make sure that our workers are not having any sickness. Okay, previously from COVID, we had before COVID, we had instilled controls for all the possible hazards. But now, since this is a biologic hazard, how do we balance, sir, or in your opinion, our healthcare delivery without sacrificing our own healthcare worker safety? Because I know there are some guidelines coming from the government, guidelines coming from different organizations, which if we try to apply in our institution, well, our healthcare delivery system will really probably suffer.
Well, that's actually that's a very difficult question to answer because from my end, we see us being healthcare providers in two aspects. The first one is this is work, right? Equal work, equal pay. But many of us see this also as a vocation, meaning beyond work, how much are we prepared to extend. And it's a very difficult place to be, especially with COVID-19. There is a lot of demand from the healthcare sector because there is a need. But what is often overlooked is that the healthcare sector are composed of people. We are not superhuman. Tao rin po kami. So, we have to find a good balance there. While I agree that we should step up beyond what we're used to be doing before COVID, simply because there's a demand, we cannot step up so much. May hangganan yan. And at the end of the day, sometimes we need, society might need to take a very bitter pill if preventive measures, public health measures are not successful. That we as healthcare workers will end up doing triage and playing God on who gets services or not. We don't want to do that, but we don't have infinite resource, nor do we have as healthcare worker infinite capacity to address everybody's needs. So that is I know that is a philosophical answer, but the reality is, kung hindi na kaya, wala na talaga. Wala ka nang mapipiga, hanggang doon na lang po. Tapos na po ang kwento. Diba? Kung wala tayong manpower, wala tayong trained manpower, wala tayong additional resources, may hangganan ng ating kakayahan. And we as healthcare provider need to accept that as well. It is a bitter pill, especially for amongst us, which we see our job as vocation as well, but we can only do so much. And our leaders, both government, and not only in the hospital, but the whole Philippine government, in fact, the whole of society in the Philippines, should be able to realize that. May hangganan lang ang kakayahan. Kaya nga we should flatten the curve and bring down the outbreak curve so that it cannot overwhelm the healthcare system. Ang kailangan siguro natin ngayon, Erlor, we need a louder voice in health, because in the shouting match between health and business, I think at this time, health is being outshouted.
Thank you very much, sir.